Hello, I'm Michelle Sanderson.
And I'm Miechelle Hwang.
We are both certified lymphedema therapists, and we're here at Wellness Within to discuss reducing your risk of lymphedema after cancer treatment and discuss some helpful self-care information if you do develop lymphedema. I'm a certified massage therapist, oncology trained massage therapist, and certified lymphedema therapist. And it's been my honor to serve the local cancer community for the last 16 years. And I'm in private practice serving oncology and lymphedema patients, chronic illness patients, and people recovering from post-op plastic surgery procedures.
I also have a private practice here in Sacramento where I serve the oncology clientele. I see people with lymphedema and other lymphatic conditions and the plastic surgery recovery community. I'm a certified massage therapist, an oncology trained massage therapist, and I have a certified lymphedema therapist certificate at home as well.
So Michelle, what is lymphedema?
Lymphedema sets itself apart by being protein rich. Regular edema, like if you sprain your ankle, goes away over time, but lymphedema stays. It can continue to swell and progress. So it's very important that you get this assessed as soon as possible. Lymphedema often occurs after cancer treatments and is because there is an interference in the lymphatic system. Michelle, how do you know if you're at risk of developing lymphedema?
That's a great question. And the question to ask yourself is the same question that we ask as an oncology trained massage therapist when you come into our office. Have you ever had a surgery, a biopsy, or radiation to a primary lymph node routing group in your neck, your underarms, or your lower abdomen or groin? So when you're asking yourself through your cancer treatment, did you have surgery, biopsy, radiation? Was it to one of these lymph node groups in very important areas, lymph underarms, or in your groin? If you had lymph node compromise in any one of these regions, you are at a lifetime risk for lymphedema. Also, people who have been through an extensive burn process in their body, or people who have undergone extensive surgeries, including even cosmetic surgeries, are at a higher risk for lymphedema. And something we've seen lately as a development is people are receiving very extensive tattooing, also potentially setting themselves up for the risk of lymphedema. And the statistics are at least 1 in 5 U.S. women will develop lymphedema after breast cancer treatment. And up to 90% of head and neck cancer patients will also develop lymphedema after cancer treatment. So Michelle, how could someone identify that they're developing lymphedema? What does it feel like?
So if you know your body really well, you will know when things are changing. The first onset that we hear reported is a sense of fullness in the limbs or in the trunk. Maybe there's a heavy kind of sensation. Sometimes that's accompanied by a tingling sensation or a sensation of numbness. One of the things you can take a look at is how does your ring fit or other kinds of jewelry. Maybe your bra fits differently. When you take it off at night, is there a bigger indentation on one side than on the other side? That's a very good indicator. And if you are at risk for lower leg lymphedema, then maybe your shoes sit differently on one foot than the other, or your pants are a lot tighter and have an indentation. So those are things that you can take a look at.
So if you do develop lymphedema, how might you craft a home care plan that you can easily follow? One of the things that's a little bit easier for people who are still in active treatment or recent recovery is that you're still in constant, pretty steady contact with your medical care team and perhaps even a certified lymphedema therapist to evaluate changes that may be occurring in your body. But if you're a long-term survivor, you might not see your care team regularly. So like Michelle mentioned before, the hallmark signs to watch out for are a heaviness or a fullness in your limb. How are your rings fitting? How are your watches and bracelets fitting? How is clothing feeling on your body? If you're feeling a new or undue tightness, it's time to reach out to your medical team as soon as you can for evaluation. If you do notice these changes, either reaching out to your medical doctor or a physical therapist who's a certified lymphedema therapist, they can help evaluate you and help you take the next steps and perhaps receive regular treatment. But one thing that's easier for people to do at home is at least once a year, if not twice a year, doing self-measurement of your limb so you can notice any changes that are happening or notice differences between your affected or unaffected limb.
We'd like to show you how to do a self-measurement of the arm at home. You're going to need 3 different landmarks. First landmark is right on your wrist. You're going to find a bony landmark right here. And then you're going to decide whether you want to do a measurement below it towards your hand or above it towards your elbow. The next bony landmark you're going to find is your elbow. Right behind your elbow there's a squishy point. When you extend your arm you can't feel it, and when you bend it you can. That's a really good landmark because it doesn't interfere with the bend on the front. And the last landmark that you're going to find is you're going to put on a bra, sports bra, compression bra, or something else that has the same look every time you put it on. And if you're a guy and you're at risk for developing lymphedema in your arm, because men can have breast cancer too, then put on a tank top, and then the hole right here for your arm, you're going to see right underneath there, right where it ends, that's your landmark, and you're going to sit your tape there. Let me show you how it looks really quickly. My measurement tape has centimeters and inches. I like to use the centimeters, but that is entirely up to you. You can go ahead and extend your arm. Alright. I like to do my measurement just above the bony landmark. I'm going to find the bony landmark with my thumb and put the tape right across. Michelle comes to 14.5. I'm going to slide the tape up here. And I'm going to find the bony landmark back here. And I'm going to put the tape right below it. When you do your measurement, you don't want to tighten it too much, and you don't want it so loose that it falls down the arm. Just nice and snug. 24. And then the last one up here, the way that I like to do it is I'm going to find the very edge. I'm going to line my tape up on the body, and then I'm going to have Michelle put her arm in, and then I'm just going to pull the tape over to her arm. And then it's on the centimeter. It's on the inches. There we go. Right on the edge here. Pull it over and move it across, and not too tight. I'm going to make sure it's not too tight. And it comes to 28. So this is a lot easier with a friend or partner to help you out. If you are at risk for developing lower quadrant lymphedema, find 3 places that's easy to measure well. Maybe the knee, just above the ankle, and to find a place on your thighs that's easy to find at the same time. Find a pair of shorts that you're going to keep for a couple of years, and make sure that the very end of that short leg is where you measure every time. On a side note to measuring, you might want to consider also measuring your other arm, your contralateral side is what we call it, the unaffected one, so that you have something to compare to. Remember, as the years go on, you gain or lose weight, and it's good to have kind of a baseline for where you're sitting if there's any difference between the right and the left. Also, remember that if you're right-handed or left-handed, how much you use that arm might affect a little bit, so there might be a small discrepancy. If you're at risk for lower leg lymphedema, consider measuring as well. Find 3 spots, maybe an ankle, a knee, and somewhere up where a short sits, and then you have the same measurements as we did with the arm. We touched really quickly on weight gain and weight loss, so let's just get over the hurdle and talk about obesity and being overweight. Unfortunately, that is a high risk of developing lymphedema for a couple of different reasons, but it also affects your overall health. It can affect your blood pressure, diabetes risks, hormone balance, and so on. If you're at risk for lymphedema or you have lymphedema, it's very important to incorporate things to address your weight. Maybe incorporate a diet. It's specific diet plan, and an exercise program. Michelle knows a lot more about diets and what kind of diets work really well for lymphedema.
So Michelle has touched briefly on how our diet does have the potential to affect lymphedema and its outcomes. And at its crux, lymphedema is an inflammatory process. So our dietary choices can impact our overall inflammatory state of our tissues. We are fortunate enough to have a colleague, Dr. Leslie Keith, who's written 2 different books concerning lymphedema and how diet can affect lymphedema and the lymphatic system. So she's an excellent resource to reach out, specifically looking at more in-depth information on anti-inflammatory diets. But we do need to say this. Diets and exercise programs must always be tailored to individual needs, so always check with your medical team before implementing changes to your diet or exercise.
So now that you have your diet and your exercise under control, the next thing we're going to talk about is skincare. A lot of women already have a skincare routine, and that's great. We've got to have to move that to the whole body, not just the face. And that's because when your skin is dry, it can break. And when there's breaking, then on top of the skin, there's always some bacteria that lives there. And bacteria love protein. So if you have edema, or maybe there's more fluid in your limb and you don't have lymphedema yet, then that bacteria just latches on to that protein and you can get really severe infections. So having a good skincare routine that consists of hydration, moisturization, and more hydration is really, really key. Another thing that's super important is to incorporate sunscreen to protect your skin barrier. And this goes to the gentlemen too out there. Moisturization, hydration, sunscreen. Having someone to help you out, figuring out what's the right products for you is really essential. So getting a hold of an oncology trained esthetician is key. There's a couple in our area, but I actually believe that there's a website out there where you can look up estheticians just like there was for massage therapists. Another thing to consider is to converse with a dermatologist to get your skincare routine down to something that's beneficial for you.
Something that can go hand in hand with your daily skincare routine is a daily self-manual lymphatic drainage routine. Manual lymphatic drainage is an excellent way not only to take care of the health of your lymphatic system, but also to familiarize yourself with your own tissue and any changes that may be happening in your body. And fortunately, I was able to partner with Wellness Within and create an instructional video that's on Wellness Within's website and on their YouTube channel, specifically showing how someone who has been through cancer treatment with a compromised lymphatic system can do a simple at-home manual lymphatic drainage session for their compromised arm or a compromised leg. But we would like to also caution you, when you're seeking out videos on platforms like YouTube, not all manual lymphatic drainage routines are created for people who have specifically been through oncology treatment and who potentially have compromised lymphatic systems. So do seek out videos that are specific to your needs, and when in doubt, again, always double check with your doctor or your certified lymphedema therapist as to what is particularly needed for your situation. So let's talk a little bit more about high-risk events that have the potential to trigger a more rapid onset of lymphedema. Things especially like puncture wounds. If you have been part of the oncology treatment process, you're very familiar with frequent blood draws. But one of the things we do need to try to avoid is having a blood draw on your affected limb. If at all possible, you always want to have blood draws and IVs on your unaffected limbs. But even things like insect bites, scrapes, stings, a pet's sharp claws breaking the barrier of your skin, any kind of accidental cut or scrape. What I've seen typically with people is they're out in the garden and they happen to be pruning their rose bushes, and a thorn will scrape them deeply across their arm. When the skin barrier is damaged by a cut or a puncture, a couple of things are happening that set you up for the potential for lymphedema. Number one, anytime the skin barrier is broken, there will be a normal inflammatory response that happens as part of the immune system trying to heal and repair your tissues. But as that immune system responds, it brings more fluid into what is an already compromised lymphatic system due to cancer treatments. Another thing that can happen is that compromise in skin barrier does leave us open and more vulnerable to infection. And infection in an affected limb also raises inflammatory response and brings in even more edema. And we have to think about these things even when the nick or the cut is very tiny, like when you're having a manicure or a pedicure. So one thing you might want to think about is reaching out to your nail technician who's taking care of your fingers and your toes for you, and ask, is there a potential that you could bring your own sterilized tools to the appointment so those tools are specific for you at each service? Or ask your nail technician, what are their sanitary practices and how might they be able to modify their session for your particular needs?
We often see a worsening of symptoms when it comes to high altitude. And there's a couple of different ways where that plays in. One, if you fly. So if you're going on vacation and you need to take an airplane somewhere, two things occur. One, you're in higher altitude, and two, the pressure in the cabin is different than what your body is used to. So we're talking about something called atmospheric pressure. It's something that we are constantly subjected to. But when it changes, that can do a couple different things. You often experience it when you get shortness of breath. So if you go hiking, it's another good example. We're here in Sacramento. If you go up to Tahoe for a hike, that's definitely a very different altitude that you'll be in. When you do experience these different altitudes, it's really important, even when you're just at risk for lymphedema and not have lymphedema, to invest in a good sleeve that you can put on. There's a couple different sleeves out there, and it's important that you pick one that's specifically designed for lymphedema patients. We have a couple examples with us today of a good and a bad one. So I am wearing a Lymphedema sample here. Now this one's not fitted to me, so it doesn't sit completely right, but this fabric is specifically designed to compress in a way that's conducive to fluid moving up the arm and into the trunk. That's what you want. When you get it fitted, make sure that you get it fitted so that it sits right on the wrist and up here in the arm, and it has the right length. If you have trouble measuring yourself, ask a certified lymphedema therapist to help you measure. These sleeves are not custom to you. They're off-the-shelf garments, so they come in small, medium, large, and long and short measurements. Miechelle is wearing a not so good sleeve. Can you see how it's kind of bulging right here? This one specifically is something that you can buy off of online stores or in pharmacies. They're often considered sports garments. People who golf wear them. You can also get something called ACE bandages. These are all designed for different kind of compression, and you don't want any of these because they are often constricting in a bad way where fluid gets stuck in the arm. So make sure that you seek out something like the Lymphedemas. These are not expensive garments at all, and sometimes they're even covered by insurance.
So we wanted to give you a quick example of what it's like to wear constrictive clothing that is simply putting too much pressure on your lymphatic system. So what I'm wearing right now is actually a really outstanding compression bra that is designed for people who've been through cancer treatment or who have lymphedema. But this bra is far too small for my torso. And if I weren't wearing this little undershirt, what you'd see here is how my skin is pooching out of the bra and these straps are digging into my shoulders. The band here around my torso is far too tight and could never allow lymphatic fluid to travel across my torso properly to shuttle fluid to unaffected lymph node groups.
I put on a pair of way too tight jeans here, and one of the ways to test if it's too tight is if your muffin top, like I have here, actually digs in to your skin here, the band, and when you take them off, there's like a really long red line across. that means the jeans are too tight. Another way to see if your clothing is too tight is if your shoes or socks are way too tight and there's indentations left behind after wearing them.
So one thing that Michelle and I see quite frequently, it's very common for people to come into the office with a very heavy purse with thinner straps on their affected shoulder. And what this does, this strap creates a limitation or a restriction, again, so that fluid that's trying to make its way up and over your affected limb cannot traverse through to areas of unaffected lymph node groups. And equally, I've seen this happen even with people with best of intentions who are trying to distribute weight better with a backpack. Both of these straps now are impeding lymphatic flow to various lymph node groups from her affected side to an unaffected side. And unfortunately, I've seen this happen twice in my practice. One time where a lady was wearing a heavy backpack at Disneyland all day, didn't know any better, and she initiated a lymphedema. And another lady who was wearing a heavy backpack and then went up to elevation to hike and actually worsened her lymphedema. So these are two different scenarios we want you to think about as you're moving forward.
We touched briefly on diet and exercise when it comes to weight management. When you embark on a new exercise plan, it's really important that you seek out someone who is well-versed within the oncology community, an oncology-trained PT, they're out there, or programs that have specific programs to get you back into working out. Even if you have been working out throughout your cancer treatment and you want to up the ante, if you will, a little bit, then you should definitely do it with a little bit of caution and with a little bit of help. If you do too much too quickly, you put too much of a demand on your lymphatic system. That isn't saying that you can't work out. I have someone who is a patient of mine who is a professional bodybuilder, and I have someone who plays tennis very regularly and who used to be a pro. And both of them are back to working out. Mm-hmm. So it doesn't have to limit your expectations or how you want to work out, but you have to have a slightly slower intro back into working out. There are nonprofits out there who have amazing programs for you to get going. And there's also your nurse navigators, who is a great source of information. The last thing I want to mention is it is important to have an exercise routine, because we know that any kind of movement of your limbs pump fluid. The lymphatic system does not have a pump like the heart that pumps your blood. The only thing that moves lymphatic fluid is deep breathing, manual lymphatic drainage, and muscle movement.
Finally, let's talk about how to safely seek out self-care services from qualified oncology-trained professionals who can adapt their services to your unique needs. Bodywork can be a marvelous addition to your oncology care program, but you need to seek out oncology-trained and certified practitioners who can modify their techniques for compromised lymphatic pathways. Like Michelle and I are oncology-trained certified massage therapists and estheticians are educated to work safely within the framework of clinical considerations for people with a history of cancer treatment. And one thing I would advise you is to look at the website of Society for Oncology Massage, and you will specifically find professionals like Michelle and I listed who have been through rigorous training programs and have met certain levels of certification and expectation. So you know those people will be safe to work with someone with a history of cancer treatment. And to that note also, with manual lymphatic drainage training programs, not all of them are created equal. You will find a massage therapists who will claim to do lymph drainage or lymph massage, but they do not necessarily have the training that's required to work with people, again, who've been through cancer treatment or have compromised lymphatic systems. So you can ask your therapist, have you received training from specific organizations like Michelle and I have trained with. I've trained with close training. Michelle has trained with the Norton School of Lymphatics, or the Academy of Lymphatic Studies here in the United States are three of the top schools where you know that those therapists who have been through those rigorous and vetted programs will be safe to work with people who have a history of cancer treatment.
Now that you've embarked on the journey of finding wellness programs and body work out there, you will encounter things like hot tubs and saunas and steam rooms and steam doing facials. These are all things that is not a good thing for someone who's at risk for lymphedema. It puts demand on the lymphatic system that's just unnecessary. So you have to consider how much heat is used in the sessions and ask questions about it. Is it safe for me? Michelle and I are massage therapists, and we've been doing this for a long time. And I use heat in my sessions, but in a way that isn't intrusive or putting demand on my clients' bodies. I, for example, don't have wet hot towels wrapped around people's feet. I have dry hot towels. You still get the same experience of heat on your feet without putting them at risk. Hot tubs is a sore subject for a lot of people because it's really enjoyable to jump in a hot tub and just relax your muscles. So out there are information about whether you should or shouldn't hop into hot tubs. Right now, the information states that if the hot tub is at 104 degrees, you can spend 15 minutes in the hot tub and then get out and still have that enjoyable feeling of being in warm water. There's a lot of different types of wellness and practices out there that you can do. Things like body scrubs, body wraps, wood therapy, cool sculpting, body contouring. All of these things are fads that are currently making its round on Instagram and TikTok. And every year something new is developed and it has a new name. The industry cannot keep up with whether that is safe for you to embark on or not. But if you ask these questions of your certified lymphedema therapist, they will be able to help you navigate through these new treatment options out there for your skin or for whatever they claim to do. Not all of them are safe, a lot of them are not, but you can find things that are. Just ask the right questions, find someone you trust to be on your team.
With all of this said, we want to emphasize that should you develop lymphedema, it's not your fault. Even with the best of care and the best of intentions, sometimes lymphedema develops.
And if it happens to you, even after following all of the advice that we've been giving in this video, it really isn't your fault, and there is help out there for you to manage it.
We hope this video helped you understand lymphedema risk reduction practices a little more and has prepared you to ask additional questions of your medical team. And we would like to thank Wellness Within for providing this opportunity, and thank you for your time and joining us today.